Hey guys, Dr. Paul Primeaux here with Spidomo. Decided to make a little video for you today about injecting yourself with semaglutide, the weight loss medicine that we're prescribing for folks who are trying to lose weight in our physician-directed weight loss program. So I wanted to go over how the medicine was going to be delivered to you and the process by which you draw it up in a syringe and then give yourself the injection. Nothing to be scared about. It's a really simple process. I will say that there may be some people who actually get the brand name medicines, Ozempic, Wegovy, and those medicines come in a pre-filled syringe that you pick up at the pharmacy, and that's a very easy process by which you're actually placing that pre-filled syringe near where your injection site is, press the button and it delivers the medicine. We're not going to go over that today. We may do that at a different video. This one is the generic medicines that are being produced at one of our local compounding pharmacy partners. This is from Galleria Pharmacy here in New Orleans. And that process is a little different from the pre-filled syringes. And so I wanted to go over that with you. First of all, let's talk about how the medicine will get delivered to you. You can actually, if you're in New Orleans, pick it up at the Galleria Pharmacy, or they will ship it to you overnight. That comes to you in a small little ice chest with a cold pack, and in it will be the medicine. It will also be a packet of syringes and some alcohol wipes. The syringes are or the needles rather on the syringes are very small, very comfortable. I'll let you see really tiny little needle on the end of that syringe. The injection is a subcutaneous injection. What that means is it goes just underneath the skin in the subcutaneous fat that covers the muscle. It does not have to go very deeply into the skin. Just barely underneath the skin, and it's injected. And I'll show you that depth with this needle. It's a comfortable technique. You can actually do it in your arm. You've had injections. I'm sure many of you have had intramuscular injections in your arm for, say, vaccinations, or maybe in your thighs, even in your hip. This medicine is typically given sort of in the stomach. All of us, including myself, have this little fat pad here on the side. And so it's very easy to access and give yourself an injection there. But if you'd rather do it in your thigh, you can do that. A little bit more challenging in the arm, and there's less subcutaneous fat there. A little bit easier to do, certainly in the side of your stomach, is sort of flank area. So let's go over how the medicine will come to you. Again, there's a vial in here. I'm just going to open this medicine bottle, and in it is the vial of semaglutide. Now, the starting dose of semaglutide, this is my first dose. I'm doing my first dose of the semaglutide in the weight loss program myself. And the first dose is 0.25 milliliters injected subcutaneously once a week. Now, once a week. Pick a day that's going to be convenient for you to inject yourself. Monday, Wednesday, Tuesday, doesn't matter. Whatever day you think is the easiest to remember. It may be Monday at the beginning of the week. It may be on a weekend. It may be, weekly on Wednesday, some kind of mnemonic that you can use to remember to dose yourself once a week. Now, let's say it's Wednesday and you're supposed to inject yourself on Wednesday and you miss, and you're one day later. That's not going to cause you a problem. If you miss 2 or 3 days, let's say you're supposed to inject yourself on a Wednesday, it's now Saturday and you've forgotten the injection, go ahead and give yourself the injection on a Saturday, but now you're on a Saturday schedule. Don't inject yourself the following Wednesday. Now it's every Saturday, and use that as the day that you'll inject. I don't want you to have too high blood concentration of the medicine. Missing a day is certainly perfectly fine. It's going to be safe. The medicine will not be as effective as it would be if you dose yourself regularly 1 day a week, every 7 days. But it's certainly not going to cause you a problem. Okay, so The first thing I'm going to do is I'm going to remove this little red cap from the vial. Then you'll notice that there's a little rubber stopper surrounded by a metallic ring, and our needle is actually going to go right through the center of that rubber stopper in this vial. Now, this is the syringe. It has two hard plastic pieces on either end of the syringe. The wider plastic cap covers the plunger of the syringe. The smaller one covers the needle. Never inject yourself twice with this same syringe. Once you inject yourself, throw it away. If you need more syringes, call us. We can write your prescription for some more syringes. They can be sent to you. If you inject yourself and recap it and use the same syringe next week, you risk infection. And I've seen it. I've put people to sleep for surgery where we're actually having to surgically go in and debride a wound that someone has because they used a dirty needle. Don't do that. Now, recapping the needles can be a little challenging sometimes. It's a tiny little needle and a tiny little cap, and you risk actually sticking yourself. I don't want you to do that. So what I'm going to ask you to do when you're recapping the needle, take the cap and put it on a flat surface, table, countertop, and then take the syringe and actually, without your hand touching the cap, not holding it, then put the needle through the middle of the syringe, press down until it snaps, and then it's recapped. And I can safely throw it away and no one's going to stick themselves. All right. So we will draw up. As I said, my starting dose is 0.25 milliliters. The dose is going to escalate each month until you reach the final dose of the medicine. So it starts with a small dose unless your body adjusts to it. So I'm going to inject 0.25 or a quarter of a milliliter. There is 1 milliliter of solution in this vial. That's a small amount of solution. And I use a quarter of it each week. So there's a month's dose in this vial. It needs to be stored in the refrigerator between dosing. So the markings on my syringe, I think that you guys can see that, are 10, 15, 20, 25, 30, up to 50. Now, the marking at 25 corresponds to 0.25 milliliters. So I'm going to draw back until the black plunger gets to the 25, right there. That's how much solution I need to inject. Now, how do I do that? The easiest way is to start with 0.25 cc's or milliliters of air, just like I have now. I've drawn back. There's just air in that syringe. And so what I'm going to do is I'm going to have the vial on a flat surface, and then I'm going to take the syringe and I'm going to very carefully insert the needle right through the center of the cap. So the needle is inserted through the cap. Now I'm going to turn it over, and then I'm going to push that air into the vial. And then slowly pull back on this white plunger. And you can see the solution now. It's kind of a pinkish reddish color. And I'm going to pull back until I get to that line where I have 0.25 cc's. Then this comes off, goes back in the container. That's going to go in the fridge. Now I'm ready to inject. So I'm just going to recap this real quickly. My syringe is all ready. Okay, so now I have alcohol wipe, and I'm going to go right here in my flank. So I'm just going to expose this area of my flank, and you can see I have a little bit of fleshy fat pad there, like most of us. So I'm going to take one alcohol wipe and really quickly just kind of give it a little swirl, clean off anything. If this is an area that you have disruption in your skin, infection, it's dirty because you just were cleaning the lawn or something, obviously you don't want to go through those areas. Clean, unblemished skin without any areas of redness. And so I'm going to uncap the needle and really easily just right under the skin at that angle. It's about say 45 degrees to the skin. I'm going all the way to the hub till the needle stops, and then I'm just going to push the fluid in. Really simple. I barely even felt it. Then this comes out. Now, let me recap it properly. Put that down and recap it. It's not uncommon that you get this response. You can't see anything. I can't even tell where the needle went in. But it's also not uncommon that you might have a little drop of blood there. And so if you do, just with that alcohol pad, just put your finger on that for a second and that bleeding will stop. Let me say something about safety. That needle is tiny. You are not going to hurt anything by giving yourself an injection there. Anything that's important, any kind of intra-abdominal organs, your intestines, your, let's say, kidneys or bladder, or anything that might be damaged by a needle stick is going to be further underneath the skin than that needle can reach. That needle will not be able to reach beyond the skin, the fat pad, the muscle underneath there, and the fascia that covers all of those internal organs. So don't be concerned that you would hit something that's a problem. Now, having said that, the one thing you don't want to do is inject it right at your bone there. You do have the bones of your pelvis come up at your hip, so I don't want you to go right into the bone of your hip, because although it's not dangerous, it does hurt. When you touch that little periosteum, that's the covering of the bone, it's quite sensitive. So don't do that. Make sure that you're in a fleshy part. You could even, sometimes it's even a good idea to maybe pinch it a little bit and then give yourself the injection. All right, so I've recapped it. This is going to go in the waste bin. I make sure it's firmly capped. I don't want anyone to get stuck with that. So we'll make sure that that's securely in place. This can be recapped. Goes in the fridge. And that's it. If you have any questions at all about giving yourself an injection of the medicine, please do call us. We're happy to walk you through it. We can do it via a short little telemedicine visit, maybe sending you the video, or actually having us come out to you and either show you the injection or do it for you. All right. Thanks, everyone.